And then we have some supplements for trial implementation. In the lab domain, it's the interlaboratory workflow. That's when you're sending your lab tests out to another laboratory for reference testing. And then the graphics and simple images and result options, that's part of the laboratory testing workflow profile. So that's more for sharing graphs from the lab results or photographs of culture plates, things like that. In the anatomic pathology domain, we have the anatomic pathology workflow in hospitals, and that's the one that we're trying to modernize and revamp in the time of digital pathology. And then there's the anatomic structure report, which I'm going to go into in more detail here in a little bit. Actually, Raj is going to talk about that one because it's anatomic pathology. And then there's anatomic pathology report to public health. A brief description of all the profiles is accessible via that web link. Next slide. And so there are other people that like this visually. So here are some of the areas of expertise within the lab that we have to cover. Click next. So there's the external workflow between the clinicians, the specimen collection facility, and the lab itself. And these are the profiles that come into effect there. And you can see up there the D stands for development. So if they have a little D next to them, that's why. P is for public comment, T is for trial implementation, and F is final text. So LTW, which is the laboratory testing workflow, labeling, and point of care testing are all final text. And the LCC has just been published, or will be published for public comment here. Has been published once in November for public comment, and we'll put it back out for public comment shortly. Next. Then you can, of course, subcontract between laboratories, so that would go from the lab order report management to the subcontracting lab and back, and that's the trial implementation profile. Next. And then we have external reporting to public health, to other caregivers, which XT Lab, APSR 2, and the Anatomic report for public health cover. Next. Then we have internal automation and operations, which is solely inside the lab for processing, that's LDA. For analytical workflow, that's LAW. And LAW we highlighted last year because we have shared that one with CLSI, and it's becoming the next Auto 16 CLSI standard and should be coming out later this year or early 2019 at the latest. And then there is laboratory specimen handoff, so that is for dealing with sending specimen along the automation track, and that's in development. Next. Then, of course, we cover transfusion medicine, and this is going to be a group of profiles. And we've started with the first one, which is the administration of transfusion and also dealing with adverse event reporting. Next. And then, of course, digital pathology is also a group of workflows that we need to cover, and that's Raj is going to talk about that more in the later part of this presentation. And that is the part that we're working very closely with SciComm Working Group 26 together, so that we don't reinvent the wheel. Next slide. Oh, and then services that can be used for any of these areas is the directory of services, that's the LCSD. Obviously, the lab needs to communicate the type of testing they do to their external partners. And then the SET, the specimen event tracking, which basically touches every single piece of these workflows whenever a specimen is involved. Next slide. So here's our publication cycle for PaLM. The framework has just been published, or is about to be, the announcement's about to go out. Middle of July, we're going to publish the APSR version 2 for trial implementation and the laboratory communications profile for public comments. Click one more time, please. We hope to publish the digital white paper in September of 2018. I guess I neglected to update the date in the timeline. Sorry about that. In November, we're having our face-to-face meeting. One more click. One more click. In Tokyo. And then in January of next year, we're hopefully publishing the LCC and the Transfusion Medicine for trial implementation. Next slide. So now we're going to focus on the newly published supplements. Next slide. The first one we're going to look at is the Laboratory Clinical Communications Profile, or LCC. Next slide. So this one is enhancing communications for orders, and basically it is an additional profile that works with either the laboratory testing workflow, which is inside a hospital, or the interlaboratory workflow, which is contracting out with laboratories. And it has two transactions, Lab 6, where the filler can recommend to replace or supplement orders, and the placer can accept or reject those recommendations. In lab testing workflow and interlaboratory workflow, the placer can replace or supplement orders, but the filler couldn't do that. So that was one of the reasons we wrote this particular transaction, Lab 6, or order recommendation transaction. And then there's Lab 7, where the placer can request specific results to be re-examined. And that is important when, for example, the result comes back from the laboratory and it doesn't seem to fit the clinical picture, for example. So the placer could send a request back to double check something, or I'm assuming in pathology that might happen also. So it can be used in either way, and it's built on 251 standard for Lab 6 with some pre-adoptions from later versions of HL7, and then Lab 7 is actually built on a new feature in HL729. There was a new order message structure introduced specifically to cover the fulfillment request. So version 2.9 is undergoing ballot right now and should be published shortly. Next slide. Gives a little bit better information about Lab 6. So this is the recommendation from the filler to the placer. So the first, do one click, please. One more. So this first black, these first black interactions are from LTW or ILW. So those are existing profiles. And then, so basically what happens is a placer requests an order, sends an order to the filler. The filler acknowledges that they can do them or not, or the placer can, send a replacement request to the filler. The red part, click please, is the LCC, is Lab 6, where the filler sends back an OML message with a recommendation or a supplementation of an order, and then the placer system acknowledges that they got the message. And during the time as part of the recommendation, there is a time window associated with it where the orders that were previously sent will be put on hold, and we're waiting to see if the placer accepts the recommendation to replace. If the placer accepts the recommendation to replace, then the filler will do the replacement orders and any other orders that were accepted and send the results back through the normal LTW or ILW profiles. If the placer rejects the replacement, obviously the filler won't do those. And if the placer does not respond in a timely fashion and the recommendation times out, then regular processing will resume and go back to the LCW or ILW workflows. So Lab 7 is, again, that red line in the middle. So they have ordered, the placer has ordered some testing to be done, and the results have flowed back to the placer, and the placer evaluates the results and then sends Lab 7 the fulfillment request back to the filler for further evaluation. So click next. That's the Lab 7.